What does the research say about TMS? Transcranial Magnetic Stimulation, often referred to as TMS, is a non-invasive technique that uses magnetic fields to stimulate nerve cells in specific areas of the brain. This process involves delivering brief magnetic pulses through a coil placed on the scalp, which induces electrical currents in targeted brain regions. By altering neural activity, TMS can lead to changes in both physiological and behavioral aspects relevant to mental health conditions, including post-traumatic stress disorder, commonly known as PTSD. Research surrounding TMS for PTSD shows encouraging results, although it is still developing. Several studies have indicated that TMS can significantly alleviate PTSD symptoms in many individuals. For instance, a study conducted in 2018 involving 35 PTSD patients found that 66% experienced a notable reduction in symptoms following TMS treatment. Patients reported fewer flashbacks, nightmares, anxiety, and an overall decrease in symptom severity. These improvements were observed not only immediately after treatment, but also lasted 4 months in some cases. One particularly effective approach combines repetitive TMS with established PTSD therapies, such as cognitive processing therapy. Research from the University of Texas at Dallas revealed that applying repetitive TMS to the prefrontal cortex just before therapy sessions led to significantly greater symptom reduction compared to therapy alone. These benefits were noted to persist for at least 3 to 6 months after treatment. Different TMS protocols are currently being explored, including high-frequency stimulation and theta-burst stimulation. High-frequency repetitive TMS is believed to improve symptoms by modulating brain circuits involved in fear, memory, and emotional regulation. Theta-burst stimulation, a newer form of TMS, has also shown early promise in clinical trials. While TMS has received approval from the Food and Drug Administration for treatment-resistant depression, it is not yet universally approved specifically for PTSD. Nonetheless, clinical guidelines recognize TMS as a safe and generally well-tolerated intervention. It is viewed as a potential adjunctive treatment, especially for those who do not fully respond to conventional therapies like trauma-focused cognitive behavioral therapy, eye movement desensitization and reprocessing, or medication. In summary, research suggests that TMS can be an effective tool for reducing PTSD symptoms in many patients, particularly when combined with psychotherapy. It offers a non-invasive option that may enhance brain function related to emotional processing and memory. However, it is important to note that TMS is not a standalone cure and should be integrated into a comprehensive treatment plan under professional guidance. Continued research is essential to optimize treatment protocols, understand long-term effects, and identify which patients are most likely to benefit. If you are considering TMS for PTSD, it is crucial to consult healthcare professionals. They can help determine if TMS is appropriate based on your individual clinical profile and ensure it complements other evidence-based treatments.